But these are built as if we live in, I don't know, the desert. Like we get no weather of any kind.
No weather. No weather. All right. So I think I am checking to see if we are live because I don't know if we are or not. Let's see. Oh, it does say we're live. Oh, that is wild. Okay. That's freaky. It's like on a 5-second delay.
Oh, yeah, we are live. It's 33 seconds in. So my section about the power lines being poorly built is in there.
Okay, so Sarah said we need a spell check on our last post. What does that mean? Did we make some really bad?
On our last post in what?
I don't know. Let's see.
In like Instagram or?
The closed one. Oh. Okay. Facebook, Instagram. It's the one she said that said we were closed.
Oh, that's on Facebook.
Was that on Facebook? This is, what am I looking at? This is Facebook. Maybe it's on Instagram. Hang on.
No, I'm looking at Instagram. There's no Instagram one.
Okay. What am I on? Facebook. Was it a... There's the religion one. It must have been a story.
Where did it come up? I saw it and I was like,
I don't see it now. Okay. All right. Well, we'll check on that. I don't know. Let's see.
Cool. Well, let me see.
Post about. I'm surprised because usually that pops out in when I'm looking at stuff. I did not notice that. Okay. Well, I don't know if I can tell if anyone's on here, but let's see. I don't see it now. Okay. Well, we got a couple more minutes. And I don't know. Let me see if I can invite Karen to come on. I'm not sure. Oh, I think I can. She may not want to, but I think she can join. Oh, she said she's shoveling snow.
Of course she is. Of course she is.
She's just like, no, taking myself out of this.
She's busy. She's doing snow.
Busy.
Snow. Love it.
All right. Well, it's 2:00. We can.
Let's do it.
We can get moving. All right.
Yeah.
We can see comments, I think, if they come through. So, all right. Well, since it's a snow day, we thought we would do this since we're not going anywhere. Everyone's just stuck at home. I'm Dr. Ann Gonzalez, Emerald Health Direct Primary Care in Hickory, North Carolina. And then this is Dr. Kelly, my partner in crime. And we just wanted to come on and do a quick kind of overview of direct primary care, since it's been a while since we've done something like this. And a lot of people don't know what direct primary care is. It's been around for, I don't know, 10, 15 years now. And I think initially, like probably 5 or 6 years ago, there were only a couple hundred offices across the states. And now there's almost 3,000. So it's definitely a growing movement. And the main thing, I guess we can get into the slides. Let's see. Oh, well, let's tell you about our office. We are Emerald Health Direct Primary Care and Aesthetics, Hickory, North Carolina, very close to downtown, founded by Dr. Kelly and myself in 2021. And we opened up after COVID because after COVID, it just, I think things were very, very difficult for healthcare people in general. Wouldn't you say, Dr. Kelly?
Yeah, there was a real like big change in healthcare, during and after COVID. And it just got weird. You know? And so and I think it had to do with some changes that happened, in the way that we practice, like as a country, like in the outpatient setting, at least, where, we were starting to, we were seeing patients during COVID in the parking lot in tents and all kinds of like weird stuff. And telemedicine really started to get really big then. And all of those laws loosened up a lot. And so the climate changed a lot. And also, I think the patients and their needs changed a lot during that time period. And it just became increasingly more, I don't want to say unpleasant, but like just more difficult to take care of people, in a fee-for-service setting, because there's just, reimbursements going down, more people need to be seen every day, in order to no time to talk to anyone about anything. And you lose the plot. When you start seeing 25, 30 patients a day.
Yeah, we got to a point where we were kind of like, what are we doing? Are we making a difference in our patients' lives? Are we able to do what we want to do in medicine? Is this how we thought we would practice medicine? And don't get me wrong, I mean, A Woman's View is a wonderful place to practice. We were spoiled.
Absolutely. Absolutely. Yeah, I think that, that's like, for fee-for-service, that's like best case scenario right there. Mm-hmm. And they were really great. And I loved working, with the OB-GYNs there. And I love that model too. I love the comprehensive women's care model. It's very, very hard because it puts a lot of strain on the OB-GYNs to offset costs. And it's a very difficult model, I think, for anybody to pull off in this country. But, I think when we left, it was a very amicable breakup. And we still work with them a lot. Yeah. And, we just wanted to do something else. We kind of wanted to try a different model of medicine, especially in this very, very quickly changing atmosphere in this country.
Yeah. And I always used to tell my patients that they used to ask me a lot, are you leaving? Because we had so many different nurse practitioners come in and out for a long time there at A Woman's View. And I'd say, no, I'm staying here, barring anything catastrophic. And then COVID happened. Mm-hmm. Catastrophe. Yeah. So we got to a point where we thought, there has to be a different way to do this. Not that we were in a terrible situation. It's just, we wanted to do things differently. And when we both found out that we'd thought about direct primary care just independently at different times, that's when we thought, okay, maybe we should do this. So that was back in 2021. we opened in September 2021, and so we've grown. We've added some things. We've added aesthetics. We've added cardiometabolic evaluations, perimenopause and menopause care. And so we've also added Karen Gimlet, a nurse practitioner that we used to work with at A Woman's View.
Yay, Karen. Yeah. She
Yay,
is
Karen.
busy with snow
She's
removal currently.
shoveling her driveway. But Karen is a wonderful nurse practitioner. She's been in practice for 20-something years. She used to work with Dr. McIntyre, and then at A Woman's View, was just now at Dr. DeSantis's office and joined us. She was ready for a change too. So we're so glad to have her. So right now we are open for new patients, taking new patients. And I'll let Dr. Kelly explain what we're doing with Karen as our new nurse practitioner, our collaborative care model.
Yeah. So, one of the questions, I've gotten some questions about, like, well, I want to see a doctor, we're coming to see you because, Dr. G is a geriatrician or you're an internist and, that's what we want to do. We want to see a doctor. But, one of the things that, we really wanted to do, bringing new patients in is create a collaborative care model where, we take all of our backgrounds and all of our knowledge and use them to improve patients' care, as a group. Karen has 25 years of outpatient, experience working with different kinds of doctors. And, Dr. G is, as I said before, a family practice geriatrician. I'm an internal medicine doctor. And so, we've all been trained a little bit differently and we come at problems a little bit differently. So, we can bring a lot to the table in terms of your healthcare, especially, when things get a little complicated. I personally see a lot of complicated patients. That's kind of what my specialty does. And, it's kind of, what I like to do. I like to figure out problems. And Karen and I, we sit down and talk about patients pretty much every day, where we discuss, treatment plans, and we discuss where to go from here and what do we think is happening. And, we consult Dr. G a lot for, things that, maybe we're not as strong in, like dementia and, mobility and stuff like that. And it just really is a nice way to practice so that you're not like practicing in a silo. The way that medicine has moved, in both the inpatient and the outpatient is a very like solo practice now because everybody is so busy. And, it's not really conducive to like good, thoughtful medicine because you basically are just left on your own from the moment you start working. And, it takes 20 years to learn everything you need to know about, medicine in order to be like a really strong doctor. I mean, it takes at least 5 years outside of residency alone to even be functional.
To be comfortable.
To be comfortable. Yeah. There's so much complexity to patients that even the patients don't even comprehend very well. Like medicine is not, you have this problem and we're going to give you this solution for it. It's never like that. It's never, one problem that has an easy fix, especially like at least in adult medicine, Yeah. So having more than one person, thinking about your healthcare and in contemplating what to do next, before you even see a specialist, if you need to see one, is I think really, really beneficial to your overall healthcare.
Yep. And being in direct primary care, because we do have less patients and we have more time, like you said, every day we are discussing all of our patients, which is, it's a benefit for our patients really to have, it's basically like three brains looking at their cases. So let's go forward here. So yes, I just wanted to mention, so we want to provide dedicated, convenient, personalized primary care to everyone. regardless of health insurance. And so that's one big part about direct primary care is we can see anyone, no matter if you have insurance or not. We just don't bill insurance at all. So if you have insurance, fantastic. We do want everyone to have insurance, at least catastrophic insurance. And if you don't have insurance, we can still see you. It's not a problem. We are glad to see you.
Exactly.
So right now, if you think about insurance, the way that insurance came about was back in the early 1900s, all the teachers, blah, blah, blah. There's a whole history about it, but it was meant to be used for catastrophic, unexpected hospitalizations. So that's where it came from. And then it's just kind of evolved into something that was provided with your employment as a way to get workers to come and stay. And then it's changed into this whole big mess of a system right now. So what we say as direct primary care doctors is primary care it is affordable, honestly. I mean, primary care is not expensive. And so if you think about things like car insurance, for example, if you were to, go get gas for your car, you pay for it in cash. You are not using your car insurance. And that's kind of what is happening here with primary care now is when you go to the primary care doctor, you're using your insurance. That's like paying for gas with insurance. And therefore, insurance becomes very, very expensive. But primary care is very affordable. Primary care doctors are trained to take care of 80 to 90% of your medical needs. So that is the majority of your care. And it really is affordable out of pocket. So using insurance right now for primary care, people don't want to go to the doctor because of their copays. We've seen people who don't want to go into the emergency room because of the copays and the costs.
Oh.
You don't know how much your levy circle. All right, I see you. Do you see me?
Yeah, I'm
okay.
For some reason, I don't know if it's you're cutting out or I'm cutting out.
I think it was both. All right, so I think we're back. So as I was saying that, you really don't know how much anything costs because no one can tell you what things cost ahead of time. You just have to wait until your bill comes in.
Yeah.
So
I was doing something this morning about, I was doing a little mental exercise this morning. Because, for me, I've been really going back and forth with in the current climate, is direct, patient care worth the money? Because, you have to pay, I don't know, 80, 90 bucks every month. And, you are not seeing the doctor every month. And so that's a real sticking point for people. They're like, well, I don't understand why I have to pay you every month if I don't see you. And so that is a point of care model mentality. The thing is that, okay, if you are a diabetic, you see your doctor 4 times a year. So if you don't have insurance or you have a high deductible, that means that you're going to probably pay roughly $250 per visit, during the year to see your primary care doctor. So that's right off the bat, $1,000.
That's your copay and your labs.
Yeah. So I'm not talking about your copay because this is a high deductible plan. And high deductible plans, you have to pay through the deductible before anything's paid for. And so you have to do that. Or if you don't have a health insurance, you're going to have to pay $1,000 a year, period, if you're a diabetic. Then you have to get labs. So you get labs anywhere between 2 and 4 times a year. So a full set of labs for a diabetic, yearly, would be probably around $500. So then you also have to get your, if you get a second set of labs done that year, it's probably going to be about $250. So there you are, $750 right there. Then normally doctors will check your A1C 2 more times, which is probably going to be about $50 a piece. So now you have another $100. So you're at almost $2,000 right off the bat, and you have seen your doctor 4 times during the year just for diabetes. So then diabetics are more common. They more commonly get infections. They get sick more often. So let's say you add in a couple of urgent care visits. The median urgent care visit number in this country is 1.4 for all comers, for all adults. So we're not even talking about people who are at an increased risk of getting infections or being sick. So for everyone, 1.4 times a year you go to the urgent care. Urgent care's baseline, it's at least $250 just to see the provider. Then you have to pay for everything else that they're going to do. They're going to charge you $100 for a flu swab. They're going to charge you anywhere between $50 and $250 for any labs they're doing. X-rays are going to be between $50 and $150. So chances are each time you go to the urgent care, you're going to be paying, probably $300 to $700. So let's go into the middle of that. So let's say $450. So you have two visits a year. So $450, that's $900. So now we're at close to $3,000 that you've paid out of pocket. So most people will say, I just do not have that kind of money. I choose to not see the doctor because I'm not going to be able to, in January, find $900 to go to the urgent care. And then, oh God, my doctor's appointment is also in that month. So now I have to pay another $400 to see them. And what ends up happening is that you either just don't go to the doctor at all, so you don't get the routine care you need as a diabetic, for instance, or you go to the doctor, but you just don't pay your bills because you don't have enough money to do so. You get behind, you get sent to collections, you get banned from that doctor, you get banned from the urgent cares, and it's this system that puts everybody who doesn't have premium insurance into a position where they're always super stressed out about their health care. And in a system that makes them choose not to seek care when they need it. So in this system, what direct primary care does is gives you a small monthly fee that allows you the access to a doctor who can do urgent care, who can do your diabetes, who can do hypertension, who can give you cheap labs, which is really hard to come by, and when I'm talking cheap labs, I'm talking less than $100 for yearly labs. And we're talking comprehensive yearly labs. We're not talking like the bare minimum.
And that's multiple sets.
And that's multiple sets, right? So I can't remember how much. I think it was $100, $90 or $100 total for diabetes labs for the year that we charge for people who have high deductible plans or for people who are paying out of pocket. So this is a model that, you're never going to get free healthcare. We voted against that. Like we are not doing that right now. But in this system, this is, I think, the best you're going to do to get the healthcare you need and not spend $1 zillion.
Right. Yeah. So as Dr. Kelly was saying, it's a monthly membership. We don't use insurance. We don't bill insurance. So anything that is taken care of by us within our office is included under a predictable monthly fee. It's the same every month. Now, if you do get labs that are what we call client billed through us, that means that we buy the lab and then you pay us for the lab. So that does not involve insurance. Those are not included in your monthly membership fee, but they are incredibly affordable compared to if you were going to use your insurance and then have your labs billed under your insurance. And because of your high deductible, you're going to pay out of pocket. So that's how our membership model works. The cost every month. We also are working, we used to dispense medicines through our office, but we're working with another pharmacy to try and get you better, lower cost medicines. So if you've heard of things like Mark Cuban's Cost Plus Meds, you've heard of Amazon Medicines, these are even better. These prices are even better than those. And we also can help you find discounted imaging prices. So we talked about the lab prices already. No copays. We don't charge copays. And that's the thing is, like, again, so if you're a diabetic and you're having issues and you don't go to your doctor because of the copays, you're just going to get sicker and sicker and sicker. And then what's going to happen is you're going to need the emergency room and the hospital.
Yeah.
But if you have direct primary care, we can see you the same day or the next day. We have a patient portal, so we message with patients directly. They can text, phone calls, of course, video visits. So like today is a snow day. I had a couple of video visits.
Me too.
No problem.
Yeah.
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 So we don't have to charge differently for a video visit, whereas an insurance, like sometimes it's not even covered. So that's another wonderful part about direct primary care is we're so flexible. And then you get more time because we have smaller patient panels. You have longer appointment times. And because of that, we know our patients in a different level, like a different level than we ever did before, right?
Yeah.
So when something happens, and even if we're not in front of our computers and somebody says something happened with so-and-so, we're like, oh yeah, that's because blah, blah, blah. Because we know our patients. We don't have hundreds and hundreds and hundreds of patients like we used to.
Yeah.
So we have.
What do you think the average patient panel for a full-time family practice doctor is? 2,500
or more.
20, that's a ton. So, I think that kind of answers when you go to your doctor and they literally can't remember who you are because you see them twice a year. I mean, that's why. And it is not their fault. It is just it is what it is. And if, and the thing is that I've said this before, if you don't care about that, cool. Like stay in the model you're in because that works for you, because that is not a priority for you. But if it is something that you're like, this makes me uncomfortable, I wish that I have a little bit of anxiety about healthcare. I wish that my doctor knew me better, and knew my history better. Then, this may be a good option for you, because it does allow us to know you better. And obviously there are times when I can't lift all of your history out of my brain and I have to look it up. But I think we always know the framework.
Right. And the other thing is, when you said, if somebody has a little anxiety about healthcare, and I would say women especially, a lot of times, a lot of the symptoms that women will have just get blown off by doctors.
Hardcore. Yeah.
And that is something that we don't do. Number one, because we're women. Two, because we have the time. And that's one of the reasons why these kinds of things get blown off is because there is no time. But our appointments are 30 minutes to 60 minutes long, and we can listen. And, that's one thing that you will not get. You will not get in the regular insurance-based system.
Yeah. And, they're actually 30 to 60 minutes, not because sometimes people will say, oh, well, I do 30-minute visits, but 15 minutes of that visit is intake from your nurse or your medical assistant. So we don't even have medical assistants. So, the visit starts, we do your vitals, we do all of that intake, we, go through meds and things like that, if we need to, but, so this is truly a 30 to 60 minute visit.
Yep.
And
so let's, go ahead.
Sorry. Oh, sorry. And we're almost never behind. I mean, I have been behind one or two times, but the other day I was, but I had a very sick patient. That's the only time we would be behind, because we give ourselves ample time to, have a good conversation with you, figure out a plan, and, get you out the door to where you need to be.
So we'll just go through some of the things that we do at the office. So we do annual wellness exams. We talked about the basic labs and the discounted labs and medications. Because we have time, we can talk to you about lifestyle changes. I mean, Dr. Kelly is obesity medicine boarded. We love to talk about lifestyle changes to help your health. Yeah. We do chronic disease management, diabetes, blood pressure, cholesterol. We take care of acute things, sinus infection, urine infection, sore throat. And then we also do some procedures in the office. We do EKGs. People don't realize that we do EKGs in the office. It's very easy. We can take off skin tags. We can send off pathology on skin, like lesions or moles. We do pap smears, basic wound care. We sutured some lacerations there. So we do just about all the primary care things that you need.
Yeah. I'm particularly interested in exercise and that kind of thing. So you will often find me teaching people how to stretch and do different exercises on the floor of the office that Dr. G loves to make fun of me about.
I love it. So we do have, of course, our monthly memberships, and it's based on age. So these are our prices. The other thing that we do have too is we have a women's midlife wellness option. So if somebody just really wants to see us for regarding hormones, perimenopause, menopause, we have the option to do a one-time consultation, which includes lab work and the consult. We do follow-up visits after that consult, or if you wanted to, you can kind of do a full year wellness membership, which will include the initial consult, the follow-ups, and the labs.
Yeah.
So these are all on our website.
And, and honestly, I would recommend the yearly, women's, because if you're going down the road of starting hormones, for instance, it really, this is not something that takes one visit to figure out. Every woman is different in terms of their needs, and one thing that I think that we do well here is tweaking your dosing, the kind of drugs you're using, to get it right and to get those symptoms that you're having under the best possible control, and then looking at the rest of your life and seeing what else we need to deal with. And a lot of times I will give people recommendations. I'll say, hey, talk to your doctor about this, from my standpoint, this is something that I think you need to do something about, or, just my 2 cents. They probably don't need my 2 cents, but I can't help myself. But I think that it's important to know that, sometimes people come to see us because they need somebody to tell them that how they feel and what's going on in their bodies is not in their heads. And just that alone, just that advice that we give alone is great for them. And they do, 1 visit, 2 visits, a la carte, and they're on their way and they're good. And then sometimes people are like, no, I need to go down this journey with you. And we, figure out the hormones and we figure out the lifestyle and we do all of that for a year. And then they're pretty good to go.
Yeah. So, and that women's midlife wellness program is separate from DPC. So if you are a DPC patient and you need hormone therapy, I mean, that's included in your DPC membership. But there are some women who want to keep their regular doctors and then just see us for hormones, which is fine.
Correct. Yeah. Which is great, actually. We love that.
Yeah, we love doing that. So some of the frequently asked questions, hours, there's somebody in the office Monday through Friday. Karen is there Monday through Wednesday. I am there Monday, Wednesday, Thursday. Dr. Kelly is Tuesday, Thursday, Friday. So there's always somebody there. We are located close to downtown Hickory on 4th Street. We do not take insurance. You cannot file for reimbursement from your insurance. They don't cover it.
But you can use your HSA to pay for your monthly membership fee.
Yes, that's new this year. So you can use HSA or FSA to pay for your monthly membership, which is great. That's pre-tax dollars, so that saves you a little bit of money.
Right. And so the insurance part of things is very confusing for people. Okay, so they'll be like, well, if I can't use insurance, does that mean I always have to pay out of pocket for my labs? Or for my radiology or for my specialist? And I'm absolutely not. So what happens outside of our office, is billed by a different person than us. So when you go to a specialist office that I sent you to, it is paid for by your insurance because they bill your insurance. when you go to LabCorp, if you want your insurance to pay for those labs, the LabCorp will bill your insurance. It doesn't matter who orders them. So that's a little bit confusing. I think a confusing piece of insurance. Now, one of the things that I tell people a lot with regards to insurance is that I am always shocked at how little people know about what their insurance pays for. So, or what, people either assume it pays for nothing or they assume it pays for things that it doesn't pay for. So, one of the things that I tell every single patient that I see is that, okay, if you don't have a Cadillac plan, like you don't have the Platinum Blue Cross plan, which pays for everything and has like a fairly small deductible, then you need to figure out how this insurance works, because some insurances with deductibles will pay for some things before you're through the deductible, and some insurances won't. So there are insurances that will make you pay out of pocket for $8,000 or $10,000 before they will pick up anything, including medications, labs, office visits, specialist visits, everything. And that's one group of high deductible plans. Now, then there's the other group of high deductible plans that there's only like a group of things that apply to the deductible. Most of the time drugs, sometimes labs, but office visits don't fall under the deductible. And so they're billed differently. So these are the kinds of things that you need to ask your insurance company about so that you know how to get the best price for things.
Mm-hmm.
Yeah. Do you know what I mean?
All insurances are different, so yes. We don't know.
Right. And it's not like
we have no idea.
Cigna, and what does Cigna do? Cigna has a million plans. And also, if your insurance is through your business and through a business, they can negotiate specific things into the insurance that other insurance plans don't even have. So this happens a lot with weight loss medications. And so people will not know whether, their, UNC Health covers weight loss meds because they work at this UNC Health versus another one and they have a different plan. So these are things that you have to kind of clarify with your insurance company. The last thing I will say about this is that just because an insurance pays for a medication does not mean you qualify for it. So, and I know this is a little bit off task, but what I mean by this is that lots and lots of companies pay for Ozempic, but you have to have diabetes to get Ozempic. So they will tell you that they pay for Ozempic and that you should be able to get it even if you don't have diabetes, but that's not how it works. So you have to meet the criteria for medications in order for your insurance to pay for them.
Yeah, it's a little tricky. They make you think that things are covered, and they may be for certain things, but not for everything.
Exactly. The last thing that's very confusing is what each insurance company defines as preventative medicine. So a lot, they're by law, they have to cover preventative medicine. So they'll cover a screening mammogram, but they won't cover a diagnostic mammogram. So they'll cover, and you'll have to pay out of pocket for that, even if you have a high deductible plan. They will pay for what they consider preventative medicine labs, but will not pay for anything that is considered to be diagnostic or something that you have to check because you already have something, like an A1C, for instance. That would not be considered a preventative lab.
Mm-hmm. And then it goes towards your deductible.
Correct. So then you get a huge bill from your insurance or from the lab after the fact.
Yeah. All these confusing things from insurance. Yeah. So as going down the list, is DPC a form of insurance? No.
It's not.
No. Can you still see your specialists? Absolutely. We want you to see your specialists.
Please do.
Yeah. Please. Do we accept members with existing medical problems? Absolutely. Pretty much everyone has existing medical problems. No problem. There's no yearly contract. We start billing when you sign up there's an enrollment fee, and then you will pay for the enrollment fee and the first month, and then it's monthly, the same cost every month. We can just request your records once you sign up with us, so we can get your previous records and review those. And then we do not share any of your medical records with the government, insurance, pharma, unless you're trying to get prior authorizations or something like that. But otherwise, we don't share. We are off the grid.
Exactly.
So I think, yeah, that was the main FAQs.
Yeah.
What else do we need to tell the people about DPC?
So let's see. What else do we need to talk about? Okay. Like, let's see. What kind of people like to go to DPC doctors? Like, what do you think, like, the most ideal patient, the person who's going to be the most happy with DPC?
So one thing that people always ask is, do your patients have insurance? And I'd say 85 to 90% of our patients do have insurance.
Yeah.
Yeah. And so even if they have insurance, what they like about our practice is that they can get in to our practice when they need us. They can reach us through the portal. They can reach us through text. We can see them, quickly, same day or next day. We can do telehealth. So if somebody has a rash or something, we can pop on a quick video call and just diagnose it. They don't even have to come into the office. And that's another thing. In fee-for-service, we couldn't do that because you can't bill unless that patient comes to the office. So because we don't do that.
They will not do anything over the phone for you.
Yeah.
Now, can you get, will someone call you on Saturday if you're having an issue?
Yep. So we cover the phones. We split up taking call generally, or whoever just gets it. But we do cover the phones. So if somebody has an emergency, we are there and we can help you. We can help talk you through whatever the emergency is, whether it's something that can wait until Monday morning when we can see you in the office, or if it's something that, you need to go to the emergency room. So we are there for mainly kind of triage kind of situations.
Yeah, exactly. One of the things that I have found really challenging, as we've moved into these like more high deductible plans, into lots of uninsured patients, because there are way more uninsured patients than there were like 10 years ago, or underinsured patients, I would call them. One of the things that I have found really challenging in DPC is trying to change the access, behavior of patients. And what I mean by that is that it's so, like, if you have not had good insurance for a long time, or you haven't had any insurance for a long time, there's sort of a mentality that, like, I don't want to bother anyone. And so, they tend to lean on urgent care a lot. And they're like, oh, I went to urgent care. And it's like 2:00 on a, Thursday. And you're like, I could have seen you.
Right.
I'm just sitting here, like, hanging out. So, one of the things that I think is really important for people to know, for patients to know, is that we want to help you change your access, the way you access healthcare. We want you to lean more on us, on our practice, because we are trying very hard to improve your healthcare and save you some money at the same time. And so that takes, I think, us kind of reiterating to patients that, we're here. Urgent care isn't some magical place that's going to fix you that, that we don't have. We have, if you're going there to get a flu swab, I can do that for you. And honestly, if you have amazing insurance and you just don't feel like coming to see me, and the urgent care is 2 doors down from your house, go ahead. But, what I don't want to do is have people feel like they have to do that, because traditionally in fee-for-service, it's hard to get in to see your doctor. It's expensive to see your doctor. It's just a pain.
Yeah.
and some people don't want to do that. Or they don't even think to do it.
Or they've tried in the past to go see their doctor when they're sick, and they've been told to go to urgent care by
They're
the
always
office.
told to go to urgent care because they won't do a urine analysis, without
Yeah.
seeing them, because they
Because they don't
won't.
have room, or
They're packed with patients,
Mhm.
and I understand. I've been there, but
Yeah. The one thing I just realized we did not talk about is employers. And that's one
oh
thing I
wow,
really wanted to talk about today. So
yes, okay,
just last thing. So DPC works very well for employers, especially if employers have a self-funded plan. And so we can work with employers. We do, especially if there are multiple employees that are signed up with our practice, we can do kind of a discounted kind of lump kind of sum. But it's much more convenient for employees because they can get in same day or next day, and it's much less expensive than a health insurance premium. We are not saying to replace, DPC does not replace health insurance, but if you're a small employer, small business employer with just a few employees, and you can't afford health insurance for your employees, this is something that you can do for them. It's not insurance, but it's better than nothing. And it will
yeah,
help keep people, on your payroll because it's a benefit that they wouldn't get otherwise.
yeah, yeah, absolutely.
So yeah, so
Very.
we are glad to work with employers as well.
hmm hmm Amazing. So I was just looking at, there were some comments, a
Oh,
couple comments, people saying nice things. Thank you for commenting in here, guys. Um, does any questions that we haven't covered, Anne?
I don't think so. I mean, that's a pretty good overview. And if anyone is watching the replay and you have questions, please, you can comment, you can call our office. I'm going to go ahead. Let me I'll put our, oh, well, the website's on there anyway, but you can
Oh,
go
it's
to
right
the
there.
website. Yeah. You can go to the website. You can contact us, call us. We're glad to answer questions about DPC. Um, I think DPC doesn't fix all of the problems of our healthcare system, but it is definitely a step in the right direction.
Yeah, absolutely. It is. It is a small piece, to improve, the problems that we're having right now, with
Mm-hmm.
underinsured and uninsured patients, especially
Right.
the underinsured.
Mm-hmm. Yeah,
You know,
and
s-
underinsured is somebody who's got insurance, but they have a $5,000 deductible.
or $10,000. Yeah,
Ten
very high
thousand. Yeah,
deductible.
yeah,
And they have to pay that the entire thing before they get to any coverage. And honestly,
right.
a plan like that is really a catastrophic plan. Like if
Mm-hmm.
you have to have surgery or you have to go to the hospital.
Right.
So
Yeah.
it's good to have just in case, but isn't going to help you with your day to day.
Yeah. Okay.
So, all right.
So I think we're just talking to ourselves at this point. So,
Yeah, we are. We are just talking to ourselves.
but if people are watching the replay, thank you for watching. Thanks to anyone who had joined us for this. We appreciate you taking your time to learn about direct primary care.
Awesome. All
All
right.
right.
Bye.
Thanks, everyone. Bye.